Hey guys, before I bring Dr. Alison Finger on, I wanted to have a quick mom to mom huddle. We are going to be talking about some really great ways to keep your kids healthy, but sometimes the labels on the bottles kind of look like they're written in a different language. So before we go into the interview, I just want to explain some terminologies so that when you hear it, you can connect the dots. Okay, so we're going to talk about dosing at one point, preventative dosing versus therapeutic dosing. So when you think of preventative dosing, think of it like wearing a light jacket because it might rain. So they're just like small daily amounts that we can give our kids just to make sure that they're ready for what's coming or just to keep their body steady. And then the therapeutic dosing is like pulling out that like industrial strength umbrella, rain boots, everything, because the storm is actually here. And so you're going to have a more higher intended dose for a short time to help them fight off whatever that specific situation is or to help replenish whatever the depletion is. Okay, so those are preventative versus therapeutic. And then we're going to talk about a vitamin called methylated B12. This is like a ready to go vitamin in the fact that you'll hear us say the word methylated vitamins in general. And basically, what it is that the vitamin has already been unlocked and is ready for their body to absorb and use instantly. So instead of having your kid working really hard to unlock the vitamin, the methylated version means that the vitamin is already unlocked and is ready for their body to use instantly in that fast pass type version of vitamin. And then the third term we're going to talk about is liposomal vitamin C. Standard vitamin C is great, but a lot of it washes through the system. So the liposomal vitamin C is basically vitamin C is wrapped up in a tiny fat bubble. And because our cells are made up of fat, that little bubble is kind of like an easy little VIP pass that lets the vitamin C slip right into that bloodstream without getting broken down by the stomach first. So it's the super absorbent version of vitamin C. So now that we got the vocab down, let's get to the heart of the conversation with Dr. Alison Finger. All right, moms, I want to talk about vitamins and supplements today. We've all stared at that vitamin aisle in the grocery store and we're totally overwhelmed. Is the organic elderberry like magic or actually juice? Like, what is happening? And then also, if my kids eat beige foods and I'm looking at like the chicken nuggets, is a multivitamin enough to save him or her from that next school virus? So today I'm sitting down with Dr. Alison Finger. She is a naturopathic doctor and founder of Doylestown Natural Medicine Center. And most importantly, she's someone who just gets the healthcare is about the whole kid and not just managing symptoms. So we're going to strip away some medical jargon and get into this mom to mom truth about daily vitamins and how to build that invisible shield around our families this season. So Dr. Alison Finger, welcome to the show.
Thanks for having me.
Okay, so, we are all on Instagram and all these different social media, and we see these perfect moms with the kale smoothies, and their kids will eat the rainbow of vegetables. But what about these kids that are just kind of like chicken nuggets and bagels? Is it possible for that beige diet kid to get what they need from food alone?
That is such a great question, I feel. And the tricky thing I think about kids is they can be different in a family. You can offer the same healthy foods, and some kids eat great foods and some don't within the same family. And then some kids eat great foods until they have more of a choice, and then things change. So, I always look at a multivitamin for kids and adults, but specifically kids because they can be more choosy, as kind of your safety net, if you will. I'm not always suggesting a multivitamin, but for those kids who really can be more choosy about what they are eating, when there's not a lot of variety, I do think a good quality multivitamin is a helpful thing just to make sure that we're getting some coverage. Now, with a multivitamin, the thing that you have to think about is, I always say there's a lot in little amounts, right? So there's many different vitamins and minerals in a multivitamin, but they're really in a quantity most of the time, and it really depends on the multivitamin. That is really not. I use vitamins and minerals for therapeutic changes, and then just to make sure we're not deficient. And so a multivitamin can be helpful in just making sure you're getting a variety of the vitamins and minerals.
So, but when we're looking at multivitamins, how do we know quality versus marketing?
Yes, this is a great question. So also something I talk about quite a bit. Two things I look at, like big picture wise. One, what are the forms of the vitamins in the multivitamin? Now, this one might be a little bit harder for someone who is not familiar with what forms of the vitamins we should be getting. And I can talk a little bit about that, but it is a little bit more nuanced because there's a lot of different things in there. So the forms of the vitamins matter. And then the other kind of more easy thing to do is take a look at that bottle when you're standing there in the grocery store, look at the other ingredients list. And for me, that's important. It really should not be a really long list of things. If you see coloring, F&D red 70, different things like that, right? So that is really not needed. The other thing to really look at is sugar, and especially with kids. And so delivery form can be a little tricky. So when you're looking at the label, look at the total sugar. A lot of kids certainly prefer a gummy over a chewable tablet, maybe. Multivitamins also come in powder or liquid form. But the real tricky thing is that in order to make these taste good for children, there's sugar oftentimes. So really what we want to be looking for is maybe a more natural form of a sweetener in a multivitamin. Stevia is a popular one. Some kids do great with it. Some kids don't. There's, xylitol, different things like that versus straight sugar. Gummies, I always warn too, if there's a lot of cavities or dental issues, you really want to be careful about gummy, really kind of maybe stick to a powder or a liquid multivitamin instead. And then teach your kids early, if you can, to swallow capsules. And I know that doesn't come until they're a little bit older, but it is nice once you can transition because then you get rid of some of the sugar. Going back to the forms of the vitamins, this one is a little bit more nuanced, but one thing I will say in general, I always check the B vitamins in there. An example would be B12. We really want to lean more into, say, a methylcobalamin versus a cyanocobalamin, methylated B vitamins in there versus some other forms. And so it is a little tricky when you go to pick them out, but you want to be thinking about the forms of the vitamins and then the other ingredients that are added.
Okay. And so you mentioned B12. Is there any other big hitters that you want to look for to make sure that it's in the multivitamin if you're going to purchase it? Like, don't waste your money unless it has X, Y, and Z. Do you have any recommendations for that?
Yeah, that's a good question too. So, I mean, we would definitely want to have B vitamins, and there's multiple B vitamins to have included. I think that's a really important thing. Kids need, and again, it depends on their diet. So they do need vitamin D. Now, I think that most kids should take it separately, and we can probably get into that in a minute. But vitamin D, growing bodies, kids have growing bones and they need some calcium. So it depends again on the diet, what's coming in. I think vitamin C, zinc are important to have in there. Iron status is a little bit of a conversation. And young kids, oftentimes pediatricians will be testing for iron in children. Some moms don't want to have the iron tested. When it's not tested, we want to be careful about giving iron to a child who does not need iron, but also small amounts of iron in some multivitamins for kids would be appropriate. So that really kind of depends. I oftentimes lean into iron-rich foods for kids also.
So for brands, is there certain brands that you recommend when you are, counseling your patients to say, hey, take a look at this type of brand of vitamin? Is there something go-to that you have?
Yeah, I mean, there's many, many brands I use in my practice. It really depends on what we're going after. I will say that I tend to lean into Nordic Naturals quite a bit, actually for kids.
Okay.
Because they make a great omega, and I like their omega-3s for kids. But they also make a chewable multivitamin that is good, and kids like the taste of that. I use pure encapsulations quite a bit because it's very straightforward, not a lot of added additives to the multivitamins and other supplements that they have. What is the really common brand that's like and health food shelves? Smarty Pants. Have you heard of that? I don't know.
I have heard of it. What's your vibe on it?
So my feeling is it's okay. I mention that because a lot of kids come in on it. Or I've also seen recently, and I don't know this brand, but Haya is one I'm seeing where people are coming in on these brands.
Okay.
And so they're okay. What I will say about both of those brands is they have the correct forms of the vitamins in them. So that is something I feel is important, as I said. And so they do have the correct forms. They're easily found more on a grocery store shelf or something like that. I also use quite a bit like New Chapter or Metagenics brand. They have some kid friendly I'm thinking of what the kids like. A lot of these kids turn them away and don't love them, but those are the brands I usually shoot for a multivitamin.
And it's hard because you're like, okay, if I'm going to buy this bottle of multivitamins, I want my kid to have it. You have to make that decision of the risk versus benefit of like, okay, it has a little bit of sugar, but it has the right vitamin form. So at least that we're getting it in. It's a tough decision though.
It is a tough decision. And I'll tell you, every single time you're going to give a child a multivitamin who cannot swallow a capsule, you're introducing sugar. And so I always say that. I always say that to my parents is, it is this pro con on both sides. And so going back to, in a perfect world, we would get what we need through food. But I know that's not always the case. I do think that each child is an individual also, and maybe their needs, will direct us towards what they need more than other kids, certainly. But I do think that if their diet is limited, it is helpful to put them on a broad spectrum.
Absolutely. Okay. Thank you for that. And then let's talk about, you mentioned like omegas and fish oils and things like that. So let's talk about those. What is your take on having them as a staple like every day? Or is it more for, managing symptoms of something? What do we use those omegas or those healthy fats or those fish oils for?
That's a great question. So I think, quite honestly, omegas are a daily supplement for most kids.
Okay.
And there's certain reasons why we would use them with certain children, maybe daily, where otherwise you wouldn't necessarily think of it. But I'm a big fan of daily omega-3 fatty acids. Now, this is assuming that the diet is not extremely rich in omega-3s, but it's very hard for us to get enough omega-3s in our diet alone. And we get other omegas fairly readily, but omega-3s can be challenging. So I am a big fan. I do think that it's helpful for the nervous system. And so certainly in our population of kids who are neurodivergent, it can be really helpful, but just for all children, really helpful for the nervous system. It's anti-inflammatory. So I use it a lot with the children I see with skin conditions, eczema, for example. I feel really strongly about an omega-3 in there. I really feel strongly about a daily omega. Now, brand, I don't know if you're going to ask me, but I know I mentioned Nordic in the past, and they have a whole bunch of different options for kids, and starting with the infant. So it's in a dropper. It's dose dependent on the weight of the child. And then they go into little gummies that you can chew or little capsules that you can chew or swallow. So it seems to be fairly easy to take. Another brand I've used for omegas is Barlean's. I can't remember the name exactly. It's something like Omega Swirl, but they have a lot of different flavors. It's a little more expensive, but kids like what it tastes like, and it might be easier to get that one in.
Okay, cool. With the omegas, what type of foods are we talking about? Like, let's just say my kid is eating chia seeds in their yogurt, and then we'll have a tuna salad at lunch. Like, what are these foods that we need to be looking for if our kid, or we can't afford to buy the omegas?
Yeah. I mean, so you just hit two big categories on that. So fatty fish, salmon probably being our best choice.
Okay.
But fatty fish, nuts and seeds.
Nuts and seeds. Okay.
Really the most readily available ways we're going to get omegas in our diet. And the tricky thing is we're usually not eating those things on a daily basis.
Okay.
Right. And sometimes we are. I mean, some parents are making chia seed pudding and, some really yummy things for kids, and they're enjoying it and it's great. But most of the time not. And so I do think, that's why I think it's nice to give the omegas to kids.
Yeah, absolutely.
Yeah. Yeah.
Okay. So that's one part of information. Yeah. So parents, if you're doing chia seeds and you're doing fatty fishes, you're fine. But if you're not, let's take a look at these omegas. And then the next thing that I mentioned was magnesium. And so magnesium is something that I've been hearing a lot about as well. And so my question was, do we find magnesium in the multivitamin, or do we also need to outsource that?
So I will venture to say that magnesium might be my most favorite supplement right now. So, and it changes, but right now I'm loving magnesium. And again, I understand, like, oftentimes I will limit myself to 3 supplements per child because we don't want to overwhelm, right? Absolutely. So understanding maybe why we would give a child magnesium, and then making the choices between the few that I mentioned today as being important. But magnesium isn't a multivitamin, to answer that. It will be in there. in small amounts. And so there is, again, back to that concept of giving a mineral or a vitamin to avoid deficiency of something, right? And then there's another way we can use vitamins and minerals, and it's really to bring about a therapeutic change, if you will. And so, or to support something. So we just talked about anti-inflammatory actions of omega-3s, right? So magnesium is one of my favorites, and it's very, very helpful for muscle. It's helpful for sleep. So you can think about all these kids that may have a hard time settling down at night. You're putting them to bed for an hour and a half, things like that. Really helpful for kids who tend towards anxiety or feel stressed. It's helpful for teenage girls with menstrual cramps. And so lots of different reasons why we would give a magnesium. There are different forms of magnesium to consider. So just to kind of keep it simple, I'm going to mention two. There's really three different forms that I use very regularly, but two forms to keep it simple. One would be magnesium citrate. You're going to get those benefits that we just talked about, but magnesium citrate also works on the gastrointestinal tract, okay, with the bowels. So if kids tend towards constipation, magnesium citrate can be helpful at producing a daily bowel movement. Now, we want to be cognizant of dosing. It also could be helpful as needed in those kids, things like that. If we want to do or try something instead of maybe conventional suggestion like Miralax, right? Then for more of the neurologic based support, so stress, anxiety, sleep support, things like that, I prefer something like a magnesium glycinate, and that crosses the blood-brain barrier, and that can be really helpful given at night to calm down the system. So that's really my biggest thoughts. Athletes, kids who are out there on the fields, and helpful for muscles, things like that.
Okay, awesome. I
It's
love
a
that.
winner.
And
Yeah.
no, that's super helpful because you're right. There are different forms. There's the glycinate, there's citrate, there's the L-threonate. There's a lot
Yes.
out there. I did hear something about, and maybe you can attest to this. I'm curious, but to stay away from magnesium blends because the blends have multiple forms in it, and a lot of them will have the form, and I can't remember the name, which it's magnesium
Right.
oxide. Was it oxide? And that doesn't do much, right?
Yes.
So you're wasting money on the blends. So get the
Yes.
specific
Yes.
glycinate or citrate
Or
when you're buying your
threonate.
magnesium, or
Yeah.
L-threonate.
Yeah.
Yes, when you're
Yes.
buying, because that makes a big difference.
That is a great suggestion. And I think so again, back to this first, conversation about multivitamins and picking the right forms. Magnesium oxide is less expensive to produce. It's not as absorbable, right? So you kind of see it creep in. And you really want to be specific about what form you're buying. The L-threonate also can be helpful with the nervous system. And so I like that one also. And then I would just say, a lot of times parents are saying, can I just give this all at once in the morning? Or when they get home from school, can I just give all the supplements? The magnesium is one where you really want to use it before bed if you're using it for calming the nervous system. Time does matter when it comes to that.
Okay. Okay. And so the last one I want to mention about like on the daily use, just for the everyday kid, vitamin D you mentioned. And you also mentioned,
Yeah.
you're like, I want to go into this later. So let's go into it. So let me ask you this first. Vitamin D, is it an absolute must, or is like 10 minutes outside on the playground enough every day? How do we differentiate?
That's a tough question, but I'm going to lean into the absolute must if I can.
Okay. Yeah.
So it depends though, right? And something I do is cycle winter, summer, and dosing changes, or we stop in
Okay.
summer. The reason why is you need skin surface. So if you're on the playground now, you've got a hat
Right.
on, you've got a coat on, you've got pants on,
Right.
and so really the skin surface that's showing is your face. And you're really not going to get much conversion and absorption of D in that situation. And so, as per summer, you're on the beach, you're out in a tank top and shorts and sandals. It's a very different situation. And so, I think maybe the smartest thing would be to really kind of change per season, depending. And then, of course, the children. Some kids are outside all day long, some kids barely go outside. So, really thinking about the needs of your child and what makes most sense for them. If your child happens to get a blood draw and has vitamin D drawn, that is really our best way to know and our best way to dose. Again, not always happening in kids, and that's okay too. So, we really start talking about vitamin D fairly early in a baby's life. There's, a little bit of a debate around if your child is formula fed, they're going to get vitamin D in the formula, most likely. If they're breastfed, we think that through mom's breast milk, baby gets vitamin D for so long, and then we need to start thinking about vitamin D. This, again, I think depends on mom's vitamin D status, and there's some nuance within this, so it's not a really straightforward conversation. But vitamin D is super easy to take. It comes in liquid forms, really easy to drop right into your child's mouth, really easy to add to food. And it's important because it's essential for bone mineralization. And so during childhood years, when there's so much growth, it really can be helpful. I love it for immune system support. So again, if we want just a winter protocol, it's definitely on that winter protocol for sure. It can be helpful for moods, stress, anxiety also. And some people really feel a difference with energy. And, I've had people come back and vitamin D is all we do. And they're like, wow, I feel so much better with energy. So it can be a really helpful supplement to give. The lowest dose available would be like a 400 or 500 IU. That's really appropriate for infants and young children. And then the dose can go up to a little bit more depending as they get older and bigger.
Okay, awesome. Okay, so let's peel back and do the full spectrum here. We were talking about these kids that kind of have this beige diet that aren't really doing the best with having variety in their diet. And so we talked about the importance of a multivitamin and the importance of making sure that you don't have a million added items at the bottom, and watch for sugar. And if you can find something with stevia or xylitol, to keep an eye out for that. Then we talked about the omegas, and they're super important. And Nordic Natural is a recommendation to purchase if you are looking for omegas. And then we talked about magnesium, the different forms, and making sure do not buy a blend. Make sure you buy either the citrate if you need bowel movement help, the glycinate if you're looking for the nervous system help. And then we just talked about vitamin D and how it's a must, especially in the winter, and it'll be super helpful for immune and also mood and that nervous system as well. So now I just want to, before I have to let you go, I want to just quick ask, we have that grouping now. Now, let's just say you are in their child's classroom and all the kids are sneezing and you're like just counting down the hours for when that virus is going to hit your house. Is there anything that you would add to that mix just for the invisible shield to not catch everything going around?
Yes, and yes. So again, trying to keep it simple. There's two ways we can do this, and there's two ways I suggest this. So sometimes I have kids on on winter protocols, if you will. So the dosing is a little lower, but they're on a daily increase of supplements, say late November through March. Okay. Yeah. And these are the kids that get sick a lot, and we just want to give them a little additional support. And so the things I'll mention, they're fairly similar in this kind of more daily dosing sick protocol. And then there's just the acute sick protocol. So you are sick. The kids in your classroom are sick. Mom and dad are sick, but the kids aren't sick yet. You see what I'm saying? So you are sick yourself, or you're directly being exposed to sick people. Then the dosing goes up a little bit for these things, but they are similar as the daily supplements. And so the vitamin D definitely stays in there. I'm going to say, so dosing is challenging. It really is per child. So it's hard for me to say on a podcast like this what the dosing should be, but sometimes I do double the dosing for just a short amount of time, say 3 days, 5 days, we'll increase the vitamin D dose, and I'll just give double the dose for just a few days. That can be helpful. Magnesium, sure, we can continue giving that, that is fine. The omegas we can continue giving. And then oftentimes I will add in a zinc and a vitamin C as kind of our baseline. All right, a zinc and a vitamin C as our baseline. Zinc can be extremely supportive for the immune system. Zinc can also, just to be mindful, create bellyache. Okay, so important to give with food, with a meal, not on its own. Typically that's well tolerated once it's given with food, but something just to watch out for. Two different brand. I mean, I don't know if you want brand suggestions, but liquid zincs. Yeah, liquid zincs The ones I usually will use or suggest in my practice are a liquid zinc by Pure Encapsulations.
Okay.
It's a dropper. It tastes good. Kids like it. Easy to give, and then you can give as much as little depending on if it's an acute protocol or a longer term protocol. And then there's something called Zinc Drink, and it's by Metagenics, and that one also tastes good. Kids like it. Easy to give. So zinc is a really nice addition there. Give with food. Be mindful of bellyache. And then vitamin C, good old classic vitamin C. I love it. It's such a nice immune system supporter. It's a great antioxidant. Too much vitamin C can lead to loose stools, but you would have to take a lot of vitamin C to get there. But just as an FYI, it can create loose stools if you've done too much. Sometimes we'll suggest a buffered form so you don't have the acidic nature of it. But most kids do quite well with a vitamin C. Ascorbic acid, again, comes in liquid, comes in liposomal forms. They also make really nice chewable tablets that taste pretty good. And this one's really fairly easy to find. So vitamin C can be a really super nice addition. So we've got D, we've got zinc, we've got C. Okay. And then outside of that, there's just a million herbs I love. But you mentioned elderberry earlier. And so I'm going to just jump on that. I will often suggest that you purchase a nice high quality elderberry syrup. Kids like what it tastes like, and it can be really supportive for the immune system. A spoonful a day through the winter season just to kind of support, or can be given one or two spoonfuls when sick or when someone around you is sick. I do like that as a nice treat.
And the elderberry, because it does taste so good, it's the kids are excited about it. So it makes you excited about it because it's not a
Yes.
battle you have to work with. You're like,
Yeah.
okay, one less thing I have to do while I'm trying to get out the door is like fight them on. They're like, ooh, I'll take that. And so that's helpful for sure. So this is awesome. And I have one question about the vitamin C. Is there any form that is more bioavailable? Like if you're going to spend the money on it, do you get the liposomal, or is the chewable just the same and just as well? What's your take?
Yeah, with vitamin C, and there's some things I'm really particular with and suggest liposomal. I don't think you necessarily have to
Okay.
go liposomal there. I mean, certainly there's a little bit of a cost difference. I
Mhm.
really think the chewable is just fine there, or a powdered vitamin C, absolutely just
Okay.
fine there. Really, unless there's some absorption question for a child who has IBD or something like that, where we're concerned. But I think, yeah, just the good old fashioned vitamin C is fine there. Yeah.
Awesome. Thank you. I appreciate
Yeah.
that advice. Okay. So I like to
Yes.
head my episodes here with Dr. Alison Finger. What is the good news? What is the good news about these vitamins and supplements?
What is the good news? I love that. I think the good news with these vitamins and supplements that we're talking about is they are easily available for all of us to purchase and to add into our life. And they are gentle and safe, and they can help keep our kids healthy and strong, which means less potential visits to the doctor and additional treatments and medications. So I think prevention and keeping healthy is such an important thing.
I 100% agree. And then the next thing I want to ask you is where can we find you? Like, what are you doing right now? Because a lot of my listeners are from the Bucks, Montgomery, and Philadelphia area. So you are local, you're in Doylestown. So
I
share
am.
how we can get a hold of you if we'd like to.
Yeah. So my website is Doylestown Natural Medicine Center, and you can find me there. And I have I've been in Doylestown since 2007. So we're nearing my
Wow.
20-year anniversary, which I cannot really believe. And I have to tell you that my social media is kind of quiet, and it's mostly a time restricted thing. But I am on Instagram. You can find me there, but unfortunately has not been super active. So my website and a call to the office, best way to find me.
Okay. And I will absolutely post your website on the show notes for anyone listening and are interested in finding Dr. Alison Finger and learning more from her. So thank you so much for coming on the show today, Dr. Alison Finger. We are so blessed to have you. And listeners, I hope that you took away some information and maybe just some organization and clarity on the next step if you need a next step for your child. So thanks everyone for listening and have a great day.